Hi everyone, my name is Bob Doane and we're coming to you live from the Acupuncture and Wellness Center in Paulsboro, Washington. We are one of the largest, if not the largest, independently owned Chinese medical clinic in the United States. We routinely see hundreds and hundreds of patients, and we've been doing so for 22 years. Our methods of acupuncture and Chinese herbal medicine and our method of pulse diagnosis, which we call medical pulse diagnosis, is branded and trademarked in my name worldwide. We teach in over 30 countries to Chinese doctors our methods, and it's a pleasure to have you here with us for this talk on psychological disorders in Chinese medicine. Okay? About 40 years ago, some very fascinating research was done by Dr. Benjamin Libet. Some say Libet, but I think it's Libet, who discovered that by looking at brainwave activity in the cortex of the brain and the midbrain, was able to determine when a thought begins to be created within the brain, when an actual brainwave pattern begins to occur. And then they were able to trace that brainwave activity till it finally created a conscious thought, so that the individual was aware of the thought. And what was so groundbreaking about the research was that there was a half a second delay between when the thought was being created within the brain and when the individual was finally consciously aware of the thought. This was an amazing result, and of course they didn't believe it, so the study has been replicated many times. And there is, in fact, a half a second delay between when a thought is created consciously by the brain itself, and a half a second later there is the conscious awareness of the thought. And this is for all thoughts, even volitional thoughts. Okay? Now what this means is that we are in fact not thinking thoughts consciously. They are being thought unconsciously, and then a half a second later you have a thought. Now you think to yourself, oh, I'll think of pink elephants now, pink elephants. But it turns out that the thought, I'm going to think a pink elephant, was in fact being baked in the body a half a second before you were aware of the thought, I'm now going to think about a pink elephant. So what this means is the physical brain is really the one responsible for creating the thoughts. And then all the human being is just an awareness machine that happens to be aware of the thought when it becomes so concrete it arrives at conscious awareness. Now, I was a celibate monastic for 10 years. And during that time, I spent most of my time with my eyes closed, meditating around the clock, usually anywhere from 16 to 18 hours a day. And that's a lot of time to sit watching thoughts. And it was very clear to me during these long periods of silence that, in fact, thought does occur as a physical sensation deep within the physiology, brain and body. And then a short split second later, you find yourself having the thought that occurred as this physical sensation. Now, most people are not aware of the physical sensation. They're just aware of the thought. And the Chinese, a couple thousand years ago, discovered this in a very interesting way. And that is, they asked the question, why do people have psychological problems? Why do they have fear? Why do they have anger? Why are they anxious? Why are they sad? And so forth. And ancient Chinese medical theory was that because there's something wrong in the body. In other words, the overall functioning of the physiology, including the brain, is responsible for the quantity and the quality of the thoughts that you have. If your thoughts are extremely depressive, okay, then the Chinese theory is that there's restricted blood flow through the liver. If the liver is fatty, if it's enlarged, if there's a restricted blood flow through the portal vein or the hepatic artery, and blood doesn't move through the liver very well, then the theory was the thoughts will be depressive. Frustrated and depressive. If the liver is inflamed, because 2,000 years ago there was a lot of alcohol consumption in China, and there was a lot of bad livers. And so the theory was that if the liver is inflamed, then the thoughts will be very angry. A very angry person is said to have an inflamed liver. Like that, if there was restricted blood flow into the heart itself, if the delivery of blood through the mai in Chinese is an ancient term for the word vessel. Mai means vessel. In Chinese medical theory is that if there's restricted blood supply through the mai into the heart, then the heart itself becomes weak. And if the heart becomes weak, then the brainwave patterns or the thoughts that that individual has are thoughts of anxiety and insomnia and fatigue. So fatigue, anxiety, and insomnia are very often associated in Chinese medicine with a weak heart. And that weak heart is caused by ischemia. In other words, restricted blood circulation into the heart will lead to a weak heart, which will lead to anxious brainwave patterns and sleeping problems. If blood supply is restricted through the lung and the functioning of the lung becomes weak, then the thought patterns will be sad. If there's restricted blood supply through the Chinese kidney, which is really the modern adrenal gland, so if the adrenal gland is, if nutrient supply and oxygen supply through blood flow is restricted into the adrenal gland, then the thought patterns will be fearful, very fearful. So in Chinese medicine, how do we treat psychological problems? We try to figure out which organ is involved, or organs, which ones are malfunctioning, where there is a restricted blood supply into which organ, and then we try to fix that. And the result is the brainwave patterns are better. So the Chinese somehow figured out that it's the overall functioning of the body brain that cooks the thoughts. It actually, the brew, the soup that you cook, and out of that soup comes brainwave patterns, or thoughts and feelings are in fact being created by the body brain. And the way to fix psychological problems is not to analyze them and not have one thought try to analyze another thought, but to fix the overall unhealthiness of the body itself. The theory is that if the person is very healthy, they'll have very good thoughts. If they're unhealthy, they will have bad thoughts. And so they did not set about trying to change the thoughts. They set about trying to fix the underlying problem in the physiology itself. And of course, this is in today's world, this is a revolutionary idea. And what's the good news is, it's not just a theory. Chinese medicine, Chinese acupuncture, Chinese herbal medicine has been treating psychological disorders for 2,000 years. And there's an absence of double-blind studies, because double-blind studies cost sometimes $500 million, and to ever convince a medical board to okay a particular procedure, and who's going to spend 100, 200, 300 million dollars trying to prove that Chinese herbal medicine works for a particular psychological disorder. That's not going to happen. But we have a mountain range of anecdotal evidence. You cannot dismiss anecdotal evidence if there is a lot of it. In a couple thousand years is a lot of anecdotal evidence. And sure enough, if the liver is determined to be inflamed or fatty or in some way not, and if you apply medicine, Chinese medicine, to try to fix the problem, if the liver panel improves, if the overall functioning of the liver improves, lo and behold, what happens to the frustrated, depressive thoughts? They're a lot better. Does it take a long time? No, it really doesn't. It's very fast. Now, Western medicine, if you have bad thoughts, then there's a problem with everything above your neck, right? It's a problem here. And so all the pharmacology in Western medicine is designed to manipulate brain chemistry. There's either not enough dopamine or there's not enough serotonin. So we have all these drugs which manipulate brain chemistry. And do they work? Yes, to some extent they do. But unfortunately, if you do a complete freedom of information, and this has been done through the Freedom of Information Act, researchers have got their hands on all the research done on serotonin reuptake drugs. These are the drugs typically handed out for anxiety. And, Effexor and Cymbalta and those types of medications. And once you see all the research that the drug companies have done on their drugs, studies which they've kept secret because in the United States, you don't have to give the FDA all the research. You just have to produce 2 or 3 good double-blind studies that show that the drug works better than a placebo. But they don't have to give the studies where it showed that it didn't work. Okay, so there might be 15 studies. 3 of them might show that the drug didn't work well at all. But they just keep doing the research, and eventually they'll come up with 3, 4 double-blind studies, submit them to the FDA, and get approval. But I forgot where it was. I think it was at Columbia. Some researchers, through the Freedom of Information Act, got their hands on all the research done on serotonin reuptake drugs, and they found that they work about 17% over placebo. In other words, placebo is 33%. That's wishful thinking. And then 17% on top of that is the benefit of the drug. Altogether, about a 50% improvement. In other words, of anxiety is about 50% from taking serotonin reuptake. That is, 33% of it is a placebo effect. And there's another problem. Very often, not always, people on these drugs, they're not really happy and they're not really sad. They're just kind of flat. They have an affect that's flat, not a lot of emotion. If you ask them, are they anxious? They'll say, well, no, it's better. Are you happy? Not really. Are you sad? Not really. They're just flat. It would be much better to find a way to make the anxious thoughts dramatically better and at the same time maintain your vitality, to maintain your energy and your vivaciousness, and yet just not be plagued by a bunch of anxious thoughts. Can Chinese medicine do that? Very often it can, yes. And it's not a panacea. I have a tremendous amount of experience. I've done, well over 300,000 patient visits in this clinic, and maybe over 400,000. And every day we're treating fatigue, anxiety, and depression. It's a very common problem, and we have a lot of anecdotal evidence that the anxiety gets better if we can find within the body where the problem is. And we do that with pulse diagnosis. We have perfected a method which we call medical pulse diagnosis, which is a bestseller on Amazon in Chinese medicine. It's called Medical Pulse Diagnosis. It's written by me. And you can buy this book. And it will actually teach you how to read pulses. And no one's ever written a book about like this. 99% of all books that have been written for 2,000 years on pulse diagnosis are not really how to do it, but are about it, about the topic itself, but not actually how to do it. And my book, and there's maybe 2 others that are actually how to do pulse diagnosis. So we're very proud of that, and it's on Amazon. So through pulse diagnosis, you can get a pretty good idea of which organ system is malfunctioning, or which organ system is inflamed, or where the restricted blood flow is, whether it's through the heart or the liver and so forth. Again, it's anecdotal in the sense of if we think someone's liver is not functioning properly, if the person has a fatty liver, or if they already have a diagnosis of a fatty liver, and we can see clearly that there's a impediment of blood flow through their liver, those people have a very strong tendency to be depressed or frustrated or both. Generally, usually it begins with frustration. And then, a year or 2 of like that, then it turns into depression. So it's like it's a progression of the problem. So what we want to do is go in there and remove the restricted blood supply into the liver and try to get the liver to function better. And we expect the depressive, frustrated brainwave patterns to be better. And usually they are, definitely over 50% of the time. So for those of you who therapy, who are loaded up on what I call happy pills, we're not saying don't do that. if you can feel 50% better on a serotonin reuptake drug, that's great. But Chinese medicine does offer an alternative idea about actually how to treat these kinds of issues. And of course, the proof is in the pudding. If you engage in something and you find over a period of time that you're a lot less anxious, then we have to make the assumption that that method probably worked, especially if it's repeated thousands of times. So Chinese medical practitioners around the world are treating heart problems, liver problems, and so forth. It's a Chinese diagnosis. If it's for the liver, it's liver blood stasis. It's heat in the liver or fire in the liver. There's damp heat in the liver. We have all these exotic terms which refer to an unhealthy liver. And then we use our medicine, specifically acupuncture and Chinese herbs, to treat that diagnosis. So if there's damp, heat, blood stasis in someone's liver, expect that person to have frustrated or depressive thoughts, one or the other or both. And when we apply our medicine to try to fix that diagnosis of blood stasis, damp, heat in the liver, we expect those thought patterns to change dramatically. Okay? If there is any form of inefficient blood flow through the heart, which in Chinese medicine is called heart blood stasis, and we apply our medicine to treat heart blood stasis, we expect the thoughts that go along with restricted blood flow through the heart, we expect those thoughts to be much, much better. And that's what we do. And it's not just us, Chinese medical professionals around the world are treating these kinds of problems. And if you're if you're suffering from something like this, and if you really are just tired of feeling exhausted and plagued by these kinds of brainwave patterns, then please give Chinese medicine a try. Our website is acupuncturewellness.net. You go on the website and you will see make an appointment. You click on that, and there's 3 questions we ask you. They're very simple. It's basically what's wrong, and that comes through to us in an email, and we will read that. We'll call you. We'll listen to your story and see whether we think that we can help. And we will do our very best to help you. I should say that what's interesting is over the years, I've seen cases of schizophrenia, and naturally these people are on a lot of medication. And I have not been able to make a significant inroad into that disease. It's a very bad disease, and it just seems to be on my grasp to fix it well, or to treat it well. But we treat a lot of mild anxieties and depressions and people who are just kind of caught in a way. And for that, as long as it's not a very dangerous problem, which we then refer to the medical doctors. If it's something where the medical doctors have already poured through you and all they can figure out is that you have chronic anxiety, but they're not exactly sure what it is, your serotonin reuptake drugs work to some extent, but not great, that's our type of patient, okay? So good luck to all of you guys. I hope this was informative for you. And what it's saying, ancient Chinese medical theory agrees with Dr. Benjamin Libet, in that, in fact, thoughts and feelings are actually created within the body-brain, and they're a physical creation, and after about a half a second, the individual becomes aware of the thought, whether it's anxious or depressed or whatever it is. And that our approach to treat that situation is to treat the body-brain physically with physical medicine to try to improve the brainwave activity. And I have to admit that Western medicine is doing the same thing. What do you think all these psychotropics do, or these serotonin reuptake drugs? What do? They manipulate body chemistry, but it's the chemistry in the brain. They're not thinking about physiology. Someone easily could get a PhD in Western medicine by getting their hands on a good 10,000 charts on people who have chronic anxiety, and look very carefully through the charts, and they might find that when they look deeper into the chart and all the different signs and symptoms that the doctors have discovered through analysis of that patient, they could very well find that many of these people have heart disease. And it's this heart problem, it's this malfunctioning heart, whether it's a restricted blood flow through the chambers of the heart or restricted blood flow through the coronary arteries, leaving the heart weak and perhaps anemic, or the functioning or the beating action of the heart somehow is deficient. If they'll look at these patients that have chronic anxiety and then they look, I think they will find that there's a very high correlation between heart disease and anxiety, liver disease and depression, adrenal insufficiency or adrenal weakness and fearfulness. These are PhDs waiting to happen, and I think, quite frankly, no one's ever thought of looking. But the data is there. The data is on their intake form. All they have to do is look on the liver panel, look on the analysis, the cardiovascular analysis of the patient, and I think they'll find that there's something going on in the heart with the people who have anxiety. Very often it's just a simple heart murmur, a mitral valve murmur or a leaky heart valve, and these are very common. They're coming from having caught strep throat when you're a child, which for some reason that bacteria has an affinity for the mitral valve and can kind of make it so it leaks a little bit. Same with rheumatic fever can cause it. And I think if they looked at people who have mitral valve prolapses or mitral valve murmurs, I think they'll find that there's a high correlation that those patients also have anxiety as well. So hopefully this has been informative. If you'd like to make an appointment, by all means go on the website and click on the right box. I'll call you.